Penetrating keratoplasty is a transplantation of a donor cornea to restore vision when the patient's cornea is thickened or too opaque or because of corneal ulcers, also called ulcerative keratitis. Since the cornea lacks blood vessels, it can be transplanted with less rejection, and 90% success rate and type matching does not occur. LASIK is performed to shape the curvature of the cornea and connect the refractory problem. This procedure is usually performed with an excimer laser and is usually done in the doctor's office, not in the hospital. Many different types of lasers can be used in eye surgery, but CO2 laser is not one of them. Cataract extraction is the removal of an opaque lens. The lens can become opaque as a result of the aging process, trauma, glaucoma, or medication. It can also occur as a congenital anomaly. It is also linked to radiation exposure such as sunlight and X-rays to protect your eyes. Extracapsular cataract extraction, or ECCE, requires a small incision at the limbus and the lens is removed using phacoemulsification, which uses ultrasonic vibrations to fragment the cataract. This is the most common method. An intracapsular cataract extraction, or ICCE, requires a large incision through the entire which the entire lens is removed. After the cataract has been removed, the intraocular lens will be implanted. This is referred to as an IOL. The surgical technologist shares in the responsibility for preventing the wrong site surgery and also for errors in the lens implant. Most facilities have specific protocols to keep the patient safe. An anterior vitrectomy is usually done because of loss of the vitreous humor during a cataract extraction when the capsule is accidentally torn. The vitreous humor is removed from the anterior chamber with the phaco machine set to vitrectomy. A tear in the retina causes sudden painless loss of vision or shattering, which appears as a curtain that descends over the patient's field of vision. Light flashes and floaters often accompany the vision loss. This is called detached retina and considered an emergency. Diseases of the vitreous gel can lead to loss of vision and are treated with a posterior segment vitrectomy. Once the vitreous is removed, the retina can be treated with cryotherapy, freezing tissue, diathermy, which is mild heating, or laser therapy. This is often a long procedure and often combined with the scleral buckling procedure. The scleral buckling procedure for detached retina is where several buckles are placed over bands attached to the sclera. The goal of the surgery is to restore the layers to their normal position and prevent blindness. Intraocular gas injection, retinopexy, is performed to create pressure on the retina, while subretinal fluid is reabsorbed and scars form. The gas must be drawn into a syringe using a filter. Glaucoma is an inadequate drainage of aqueous humor that can cause damage to the optic nerve and lead to blindness. The intraocular pressure, or IOP, is measured with a tonometer. An iridectomy is the removal of a section of the iris tissue to reestablish communication between the posterior and anterior chambers, reestablishing the outflow of aqueous fluid through the Schlemm's canal. A trabeculectomy is also referred to as a trab. It's performed to create a channel from which the aqueous humor may drain from the anterior chamber. A drainage device can also be implanted to facilitate the decrease in pressure. Orbital decompression is always done to treat hyperthyroidism or Graves' disease. In this procedure, one or more bony sections of the orbital cavity are removed to reduce pressure on the optic nerve. Enucleation is a complete removal of the eyeball or globe. IT is performed to treat intraocular malignancies such as melanomas, retinoblastomas, or penetrating ocular wounds, a painful blind eye, or an eye that's blind and painless but disfigured. Evisceration is the surgical removal of the contents of the eyeball with the sclera left intact. And externation is the complete removal of the contents of the orbit. This procedure is also performed for cancer, but is more extensive than an enucleation. Externation is a surgical removal of the entire eye, eyelid, ocular muscles, and orbital fat. A conformal is often temporarily inserted to shape the orbital cavity after enucleation. Once the area has healed, an artificial eye designed to allow blood vessels to infiltrate the implant material of hydroxyapatite is implanted. Terms to be familiar with. GTTS stands for drops when giving medications. OS means your left eye, oculus sinister. OD is your right eye, oculus dexter. And OU is both eyes.